Hi, everyone. Sorry we're running a couple minutes behind. This is take number 2. The first time it didn't go all the way through. I'm here with Dr. Christina McGee, and we're super excited tonight to talk about some more taboo topics that don't get talked about enough, I think. Christina is a PT here in Austin. If you know anything about birth professionals or PT and pelvic floor in Austin, you will have heard her name somewhere. She's kind of leading the movement for pelvic floor health. So thank you so much, Christina, for being here. If you want to go ahead and introduce yourself a little bit more.
Thank you so much. I am a pelvic floor physical therapist at a clinic here in Austin called Sullivan Physical Therapy. There's 10 of us, doctors of physical therapy there, and all we do is pelvic health for the whole lifespan, people of all genders. But today we're going to talk specifically about pregnancy, postpartum issues, and specifically returning to sexual function after having a baby.
Awesome. So I'm curious, why did you choose to take PT in this direction, working with pregnant moms and pelvic floor health?
You know, it's just kind of like domino of circumstances, but really it was an area that really caught my interest during PT school, and I didn't necessarily know I was going to start there, but I did, and I love doing education. Education is my favorite part of being a PT, teaching people what's going on with their bodies, how they can care for themselves, really just being an advocate and teaching people how to be their own advocates for their own health. So I think pelvic health in general, but really kind of that pregnancy, postpartum time is a time where things get brushed under the rug a lot. People assume that some of the things they're experiencing, oh, that just happens during this point, and then they don't seek help, which is really unfortunate because there's so much help to be found and so much improvement to be sought. So I really enjoy talking about stuff like this so that lots of people know how they can not feel like they're kind of not themselves or a little off after having a baby. They can go back to feeling like they own their own bodies.
That's great. I love that. I know there's a lot of focus on baby, especially that first part of postpartum.
Yeah.
We're super excited to have you here and chatting about how mama can take care of herself too.
Yeah.
All right. So like you mentioned earlier, we're going to talk a little bit about returning to sex and sexual health after you've had a baby. Is that right?
Mm-hmm. Yep, absolutely. It's a big topic that lots of people I usually have to specifically ask them about it, but then once I do, they usually have lots and lots to say. As long as I ask the right questions, they have lots of thoughts on it and a lot of grumbling a lot of times. And sometimes they've talked to their providers or they've talked to friends and family, and they're not really sure where to go or how to kind of navigate the field. So I think we can talk about that a little bit more.
Sure. And you mentioned earlier that a lot of these new moms think that what they're experiencing is normal. So what are some of the things that you see, especially specific to the topic we're talking about, that are just not normal and maybe red flags?
Yeah, so I think most commonly is painful intercourse. And a lot of times I've even watched message boards kind of like build themselves, or Facebook groups of moms talking about returning to sex afterwards. And people are asking, is it normal that I hurt? And people's responses are like, yeah, absolutely. It's going to hurt for quite a while. And I'm like, no, that's not normal. It's common. And this is something I say across the board for so many things that we treat: common, not normal. So if you're experiencing it, you're not the only person that that's happening to. It does happen very frequently, but that's not how your body be functioning. If you're having painful intercourse, if you're having significantly decreased sensation during sexual activity, you used to be able to orgasm and now you can't. You're having burning or tearing or bleeding. All of those things are not supposed to be happening.
Sure. And I told you this before we jumped on live, but I was speaking with a patient recently who had mentioned she was going to go to a PT, but then she wasn't having pain every time. So she thought, well, then it's probably not a big deal. Do you want to share your thought?
I mean, I think that's the same thing as saying, like, I have knee pain and it only hurts 75% of the time when I run. it's probably not my knee. Like it's still a problem. It might be that over time, some things are improving or you're seeing some adjustments, but if you're still having pain, you're not supposed to have pain. That's not normal. It suggests that there's something else going on. But the fact that it's now only happening sometimes, it might be easier to get after it more quickly if the problem is somewhat resolving itself.
Sure. That's great. So what could possibly be playing a role in causing pain?
So actually a number of things. Sexuality is super complicated. And when we throw a new human being and a completely changed body into it becomes really, really complicated. So we have new relationship dynamics with your partner. We have a new schedule. You're off your sleep. Your body just doesn't feel the same. Maybe new body image issues going on too. But when we're talking from a very physical standpoint, if you're breastfeeding or you're early postpartum, you're going to have lower estrogen levels, and that can cause that burning, raw, chafy sensation that some people get, which means that lubricant is definitely necessary, but it might even be something more like lubricant isn't enough to take care of it. People can end up with a more tightened pelvic floor after delivery, whether that be a vaginal or cesarean delivery. I think a lot of times people think, oh, I had a baby, everything's gonna be like loose and stretched out. That can happen, but also a lot of times your pelvic floor seizes up afterwards almost to protect you, and that tightness can cause painful intercourse, like the muscles shut everything down. Or if you had an episiotomy, if you tore that tear site and the scar can be painful as well, or a combination of all three, which is really common. So it can be a few different issues contributing to it. And I did want to emphasize it can be in mamas that had a cesarean or in mamas that had a vaginal delivery. Both can result in painful intercourse. So don't think if you had a cesarean and now you're having painful intercourse, it's not related. It can absolutely still happen.
Sure. So what are people can do on their own to make that go away or fix the problem?
Yeah, and there might be things that you can do from a home standpoint, and then it might come to the place where you say, I tried those, it wasn't enough, I think I need to get help. Things to do at home: use a really high quality lubricant. So if you are not using condoms, you can use olive oil or coconut oil. They're safe to use internally, but they degrade latex. So if you like blow up a balloon and rub some olive oil on it, the balloon will pop. You don't want that to happen to your condom. So if you're using condoms, then you want to use a high quality water-based glycerin-free lubricant. We use, at our clinic, we use something called Slippery Stuff. It's actually the name of the lubricant, and it's a gel. It's a little bit thicker, not in a gross way. It's like a protective thickness. So I think some lubricants, like you put them on and then like whatever you put it on is like dry and you have a puddle underneath you, and that's not very helpful. So like it's a thicker gel-like lubricant that can be helpful. Also practicing really deep belly breathing. What happens when we take a deep breath is our diaphragm drops, our pelvic floor drops. So even taking a big belly breath like that will actually, if you're watching from underneath and you're like doing a vaginal exam on someone, it'll actually do this as you breathe in, as you breathe out. So you'll actually get a widening of the vaginal opening with a big deep breath. That's something that's a great trick that I teach a lot of people. And if you have scars, yeah.
Real quick, that's something people should be doing before sex or during or both?
I think it's good to do before, especially if you're kind of like been super busy and running around and you know you have some tightness there. It's kind of good to like quiet your nervous system down. I mean, it's deep breathing. You can't hurt yourself deep breathing. It's good at any time. But actually in the moment, as you're trying to achieve penetration of anything, like a finger, a toy, a penis, whatever you're trying to insert, an exam at the gynecologist, big deep breath, right before insertion.
Okay.
Mm-hmm. And then if you have scars, whether they be episiotomy or tearing scars, if you start rubbing those scars kind of on a daily basis with maybe coconut oil or olive oil, that can be helpful too to break up that scar tissue.
See a PT, that this is not going to resolve on its own? Are there any major signs?
If you're doing all those things, you've massaged your scars, you're doing your deep breathing, you're using a good lubricant, and there's still pain there, there's something else going on, and it's time to check out PT. And we really try to look at you as a whole person. So if you're also talking about things like, this has really led to all these arguments with my spouse, or this has really changed my self-image of myself, or I'm really scared to go back to intercourse, or maybe if you've had a history of sexual trauma before, and now this is kind of all bringing it full circle. We really collaborate with sex therapy all the time, with mental health all the time, with parenting experts, with anyone we possibly can to make you feel treated as a whole person, not just as like a floating pelvic floor through the world. Because you're a whole person, especially when going into sexuality. It's so complicated that sometimes we need support from all different angles in order to make that successful and for you to meet your goals. Because I don't just want it to be not painful, right? Like, I don't just want you to tolerate sexual activity. I want you to have a fulfilling sexual experience. So it's not enough to just like fit piece A into piece B without pain. Like, we want to get you to the point where you're actually enjoying your sexual experience too.
That's great. And do you find it when you're working with clients that topic in general is difficult to talk about, or you just have to get them a little warmed up and then people typically then are okay?
Yeah, I don't lead with it. I talk to people about like themselves and what they do during the day and their interests and kind of the reason they're coming to me first, because a lot of times they're coming to me for something else. They might be saying, I'm here for my urinary leakage, or I'm here because I have hip pain. And because everything in the pelvis is so squashed together, no matter what you're coming to me for, I'm going to screen a whole bunch of topics. I'm going to ask you about your bladder function. I'm going to ask you about your bowel function, because there's clues that I can pick up from all those different areas to really paint a bigger picture of what the underlying root cause of the issue is once I have all those pieces. So I ask everyone about sexual function, even if they're there for belly button pain. Like, I'm asking them about sexual function because it can be something that also gives me a lot of clues as to where the underlying problem is. And I think as long as you ask people in a really respectful and open-minded manner, there's not a wrong answer. I just want you to answer honestly. And I'm not uncomfortable however you answer. So let's just talk about like what's going on, any concerns you have, things that you've noticed that are different since before baby. And then what you want that experience to look like afterwards. And let's figure out the steps we need to get there. Yeah, I think a lot of times health professionals they're the ones scared to ask. And so even if they get to asking, once they get to, they're all like, like nervous and not sure how to ask. And then if your doctor looks like that when they're asking about it, how are you going to respond? You're going to be like, ooh, you're nervous, so now I'm nervous, and I'm not going to give you very much information. But since this is something we screen on 100% of our clients, I mean, as long as they're above like 16 years old, I'm screening this on you, then for us, it's just like another piece of the puzzle. Just like if you had hip pain, you'd probably ask the person about knee pain or back pain or stuff like that. It's all bound together.
Sure. So someone just commented from Facebook, and the comment says, can diastasis recti contribute to pain during sex after giving birth?
Interesting. Certainly both can occur at the same time. I usually think of diastasis more contributing to things like urinary leakage and prolapse, and back pain and hernias and its own group of symptoms. But certainly if you have diastasis and it's been hard to heal, if you're trying to work through it and it's hard to heal, that could mean you have some scar restriction in your abdomen, actually. And if you have scar restriction in your abdomen, that could be contributing to painful intercourse. But my answer would be, it could just be, you know, you have a little bit of this here and a little bit of that there, and we can get them both fixed. I don't know that I haven't thought of diastasis directly leading to painful intercourse. Maybe decreased sensation during intercourse, though. That's one thing I would maybe put together.
Sure. Now, I know some people get nervous going to providers in general, whether it's, you know, PT, the OB. So let's say someone comes into you or another PT's office. What does that first experience look like a little bit?
Yeah. So we're, at least in our clinic, we're all in completely private rooms. So you're not out in the middle of a gym being asked these questions. You're in a really comfortable room. If I'm your provider, then it's just with me. And we just sit in chairs and talk about kind of, like I said, what brings you here? Okay, let me ask you about these other things that might be going on. We get kind of a full background on you, other things going on in your health in general, and your goals. What do you want to get out of this experience? And then based on that, we choose what kind of exam we're going to do. So I probably look at your posture. I look how you breathe. I look at your abdomen. I might look at your spine. And these might be things I get to the first day, or depending on how, you know, we might prioritize it or deprioritize it and look at it a different day. But I'm going to look at your abdomen. We're going to look at inner thighs. As long as you are comfortable with it, we're going to look at the vulvar tissues on the outside. So those tissues like the labia, the skin there can really impact what's going on with intercourse and pain. So I try to get clues based on that. Is there something that I can have influence on, or something I need to refer you back to your doctor to have addressed at that skin right there? And then again, as long as you're okay with it, we would probably do a vaginal exam and just see. There's no speculum, there's no stirrups. It's just us feeling what's going on with those tissues to get a better idea of how we want to proceed with treatment. But if you're coming to me and you're like, I hate exams, this hurts so bad, I hate intercourse, I don't want to have anything to do with this right now, but it's my eventual goal to get back to intercourse, then I'm not doing a vaginal exam the first day. That's like really mean. I would not do that. So let's talk about all the things you can do maybe this week, maybe the next 2 weeks, while before you see me next, to best prep your body so that exam is not going to be painful. We're going to work on stretches, breathing techniques, maybe some desensitization where you're rubbing your scars, things you can do at home so that by the time you get to the exam, it's not scary anymore. You have all the skills you need to make that not painful and successful. And then you're more likely to move forward, because if every time you have something inserted, it hurts, well, your body learns that, and then it's just going to fight it harder and harder and harder. It's going to spasm harder to try to avoid that. And that's the exact opposite of what I want. I want you to be able to go into any experience saying, I feel in control and I feel like I know what I can do to make this better for myself.
Awesome. That's great. Well, that's kind of all the questions that I had for you. Is there anything else in general that you wanted to share?
No, some things that people might have heard of before are dilators. I don't have one. I was thinking of bringing one and then I forgot. They're essentially like a tiny foam roller for your insides is how I describe them. So they're just like think of like a plastic tampon, but they come in all different sizes. And some doctors will go to that as their first resort, or some PTs maybe even. And they say, okay, go home and insert these dilators, start with a small one and then work up to it. I have nothing against dilators, but I think there's a lot more to the progression than just using dilators. So especially if you've been handed a pack of those before and you're like, what the heck am I supposed to do with this? You gave me no instructions. You could bring those to a PT and say, my doctor gave me these. I thought about trying them. I didn't really want to, or I tried to use them and I don't really know what I'm doing, or it's still painful. We can integrate those into a whole program if you're interested in it. Or there's a lot of people who I never end up using dilators with. We kind of address it a different way. I think there's a time and place for them, but not 100% of people. And that's not all we're doing. If you're seeing me, we're going to do a lot of different stuff. So if you've been given dilators before or have heard of them, they're a potential piece, but not all of what we do. But yeah, I think that we kind of covered a lot of important stuff. But if other people have questions, they can always email me or write in the comments and we can try to follow up with any other information that would be helpful.
Awesome. So I put your email up on the screen if anyone wants to copy it down. It's just Christina@sullivanphysicaltherapy.com. So we have a lot of people in our mom group from Austin, but there are a few people from other places. How would they find information on how to find a PT that is as trained as you are in pelvic floor health?
Yeah, so there's a few places. You can go to the American Physical Therapy Association website, and they have a link that says Find a PT. You can put in where you live, and then you're going to click on Women's Health, which is a subset. It's kind of like the umbrella under which I function, even though I treat people of all genders. So if you click on Women's Health in your area, then it'll show people that treat pelvic floor in your area. I would always try to get in contact with them first and ask specifically if they treat what you're dealing with, because, you know, within every profession, there's people that have specialties. So I would get in touch with them first. And then there's also pelvicrehab.com. Let me double check that I'm telling you the right thing. Pelvic rehab. Okay. Yes, pelvicrehab.com. And they are a provider list that has been trained under a specific continuing education company that is pretty reliable. So you can go to their website and then just put in your area, and all that's going to show you is pelvic floor providers that have had continuing education. So they're both pretty good resources.
Perfect. Awesome. Well, thank you so much for spending time with me tonight, Christina.
Absolutely.
I know you've got a little one at home, so I so appreciate your time.
Absolutely. Thank you for having me.
Thanks so much for joining us. Like Christina said, if you have questions for her and you want to comment down in the comments, I will try to tag her or let her know if it's something that you're kind of asking directly to her, and she should be able to answer it. Or you've got her email address if you just want to speak with her privately. She's amazing. All of her patients love her. So if you've even considered going to a therapist for anything at all, really, make sure to reach out to her because she's really a fantastic resource in Austin.
Thank you.
You are welcome. All right. Thanks again, Christina. Have a wonderful night.
You as well.
Bye.
Bye.